Welcome to Alpha.
Starting in a few seconds, guys. Can you hear me?
Welcome to Alpha.
I can't hear.
Yeah,
Can
I can hear you.
Okay, okay. All right. So we're starting 59. We start properly 2 o'clock. Are we ready with the slides, Sweetway?
Yes, ready.
Okay, first slide up. We're starting now. Good afternoon. Welcome back to our First Baptist Church Community Connection. We present to you COVID-19 Survival Guide, Part 2. We're having this seminar or webinar today simply because there's such an overwhelming response last week. So many questions, 40 over questions unanswered, a lot of anxiety stirred up among the public. So we're bringing this up to try to allay the anxieties, not only with the rising COVID numbers, but also this worries about the various issues with regard to vaccinations. Can I have a show of your like buttons on your Facebook for those of you who have been with us last week, so we know who you are? I think there are a lot of people who have been with us last week as well. Good. Right. Okay. So now, today we're going to be looking at you're joining us with live stream and Facebook. We're very privileged to have with us a whole panel of doctors who are specialized in their various specialties to answer these questions with some degree of authority. We've got panelist Dr. Alan Tay, who is a hematologist, Dr. Ian Ping, pediatrician, Dr. Yap Lok Bin, who is a cardiologist, and Dr. Tan Sui Ping. Unfortunately, Dr. Chin was not able to join us today. I'll be introducing each doctor individually as we go into their talks. And for the rest of you, we need you to participate with us by simply putting questions with us. And your questions can be sent via YouTube or Facebook chat. Just put that there so that we can be able to monitor and bring out all the most relevant questions to the relevant specialists, right? Some of you, I'm sure that many of you out there some of you actually may have had COVID-19 before. Maybe you want to show us a like button to so that we can have a gauge of what kind of audience they're out there. Because if you've had COVID-19 before, then the issue that might be of interest to you is perhaps the issue of long COVID, which Dr. Tan Sui Ping will speak about afterwards. Okay, can we have the first panelist coming up? Is before we start, you have to realize that all the opinions expressed are by the doctors here individually. If you've got any specific questions, please consult your family doctor for specific instructions. This is only for educational purposes only. Right. So the first speaker is going to address Dr. Alan Tay, who is a hematologist in Subang Medical Center. For all of you in First Baptist Church, you're aware how he helped out in our sister Tan Lei Siu. She had grave illness, and Alan was able to help. We're very grateful to him for that. He's going to speak to the topic which is of most concern from our last week's survival guide edition, and that's blood clots. How do they form in COVID-19? What about AZ vaccinations? How this happened? What are the risks? Alan, over to you.
Thanks, Peter. So I'd like to thank your the First Baptist Church for asking me to speak, and I hope that my little presentation will allay your fears, particularly about this issue about blood clots and the AstraZeneca vaccine. Okay, somebody's sharing the screen for me already. So next slide, please. All right, just some essentials about vaccine, right? I think you all should have no doubt by now that vaccination will protect you from becoming very ill with COVID-19 infection. And the AstraZeneca vaccine has been shown to be very effective in the real world rollout in preventing severe illness, hospitalization, and death. Now, in fact, all the vaccines practically prevent 100% of death due to COVID if you are adequately vaccinated. Okay, so I mean, this is the most important thing, which is you're going to benefit from vaccination. And the AstraZeneca vaccine is approved by the Malaysian National Pharmaceutical Regulatory Authority, or the MPRA, as a safe and effective vaccine against COVID-19 for adults 18 years and above. Okay, next slide, please. So the common side effects you experience may be a bit of pain or tenderness at the injection site, some tiredness, headache, a bit of muscle pain and fever sometimes, and a bit of chill sometimes. But this is usually short-lived in a day or two. Okay, they will disappear after a day or two. Now, the big concern, which has been spreading around in the news, social media, is the extremely rare side effect which is now known as the thrombosis with thrombocytopenia syndrome, or TTS. Thrombosis is the medical term for blood clots, and thrombocytopenia is the medical term for low platelets. And the rate is variable, but very low. And it's something around about 10 per 1 million doses have been reported in the West, okay? And there have been no specific risk factors identified for TTS, though there's some suggestion it's a little bit more common in younger adults and a little bit more common in women. Next slide, please. Now you got to put this in perspective, okay? We say what, 10 per million or so with the AZ vaccine, but don't forget that the COVID-19 infection itself is associated with a very high incidence of blood clot. It is not just a lung infection, it's actually a systemic illness where there's inflammation and leading to blood clots in the brain, in the lung, the heart, and so on. So to the extent that we routinely now give blood thinners to people with severe COVID-19 infection. So the infection itself has a much higher risk of blood clots compared to the AZ vaccine. And if you're very concerned about blood clots with AZ vaccine, just think about the risk of blood clots with smoking. If you're a heavy smoker, well, like more than 20 sticks a day, after 1,000 smokers, maybe 1.5 will get a blood clot. And even pregnancy, there's a risk of blood clot. So women, if you're not afraid to get blood clots, it's 1 to 2 per 1,000 pregnancies. So we got to put things in perspective. Okay, next slide, please. The thing is that the TTS is distinct from other clotting conditions. It's a very unique and peculiar mechanism. Okay, it's triggered by an immune response to the vaccine, resulting in both thrombosis or blood clots and low platelets. And what happens is there are some abnormal antibodies, pathological or abnormal antibodies, which target a platelet factor 4, which is a protein released from platelets. And these are detectable in the blood test. It's very similar to something called the HIT syndrome or heparin-induced thrombocytopenia. This is also a very rare side effect of heparin, and you might know that heparin is a blood thinner. So we rarely see low platelets and then blood clot when we administer heparin. But this is so rare, it doesn't stop us from using heparin. It's just something that we are aware of when we use heparin. So TTS has been reported in patients who have received the AstraZeneca and also the Janssen or Johnson & Johnson COVID-19 vaccine, has not been reported in the other vaccines like the Pfizer or the CoronaVac or Sinovac vaccine. Okay, next slide, please. So because it's a very specific mechanism, and this is a thing that a lot of people are very worried about. So the risk of vaccine-induced TTS is not increased in people with the following conditions, and these people can receive the AZ vaccine. So if you've had a history of blood clots before, like deep vein thrombosis of the leg, pulmonary embolism, you have an increased clotting tendency, particularly with this non-immunological, as most of them are. If you have a family history of blood clots, whether you've had history of ischemic heart disease, heart attack, or stroke, whether you have low platelets, or even receiving anticoagulation therapy, these are not going to increase your risk of TTS, and does not contraindicate you or prevent you from receiving the AstraZeneca vaccine. All right. Next slide. And we really want to look at benefits versus harm. Okay, like there's no such thing with any vaccine or any drug for that matter without any potential side effect or adverse effect. So for 100,000 people, the potential benefits for preventing death will exceed the potential harm, particularly in the older age group. Again, I think this is why it's not so much in the younger age group, because the death rate in the young age group is very low. Okay, so it is particularly striking in the older age group for preventing death. Next slide. And also preventing ICU admission, same figure. Okay, so the benefits far outweigh any potential harm with the AZ vaccine. Next slide. All right. If anything, this is a take-home message. So the benefits of vaccination greatly outweigh the risks. Okay, next slide. Just a little bit more detail about TTS. It's rare, but we do recognize it's serious and indeed potentially life-threatening. But the take-home message, again, it is treatable. So it is not something we take lightly, but it's not something you will inevitably die from either. Okay, next slide. So those who have received the AZ vaccine would be advised to watch out for these things. Okay, not likely to happen. Chances are you won't. But if these things happen within 4 to 30 days post-vaccination, if you have a severe headache that does not improve with simple painkillers like paracetamol, gets worse when you're lying down, accompanied by nausea and vomiting, this suggests increased pressure in the brain due to, for example, a blood clot in the veins in your brain. Okay, or if there are neurological symptoms such as blurred vision, difficulty with speech, and drowsiness, or even seizures or fits. Okay, if you have shortness of breath or chest pain, swelling of the leg, or persistent abdominal pain, abdominal pain may suggest some blood clot in the veins in the abdomen as well. Tiny spots under the skin, which are also known as petechiae, are bleeding spots which can be seen when your platelet counts are very, very low. Okay, so if you have these things, please seek medical attention, and the doctors will have a treatment protocol. I just want to just to show you that we have these things in place. Next slide. Next slide, please. So this is just the diagnosis and management algorithm which the doctors will follow, and this is produced by the Malaysian Society of Hematology. If you have suspected COVID-19 vaccination-related TTS, what we have is actually an algorithm, what tests to do, and what is the treatment which is advised. So, but you have to seek care if you have those warning symptoms, which I've alluded to earlier. Okay, so I think that's my brief presentation from now. Thank you for listening.
Thank you so much, Alan. Just before we go on, I just have 1 or 2 questions, and I will save the rest for our Q&A session later on. Now, basically, if let's say you have younger people, young women from the age of 18 to about 30, looking at your slides, the potential benefit versus the potential harm, they're more or less in a similar kind of ballpark. Would it be wise if you have daughters at that age to tell them, why don't you go and take Sinovac or something else? Do you think that's a reasonable advice, Alan?
Okay, so that's not a reasonable question, and this is a question we get all the time now. Yep. Okay, I think the risks and benefits of all will depend on what's the current situation in the individual country. These were data, I think, I got the figures actually from the Ministry of Health, AstraZeneca leaflet, actually, but they're quoting European figures. I think we have to look at the scenario in each country, and the risk will, of course, greatly escalate if there are many, many more cases. And the things which happened earlier are not the same as happening today, where we are having like 5,000-6,000 cases every day, and 50 to 100 people dying every day, and ICUs overfull, and you're going to have even collateral deaths due to inability to get into ICU, even though you're trying to get in because it's a non-COVID related illness. So these are the things which actually we have to look. If the situation is very bad, if patients ask me, what vaccine should I have? The first vaccine you can get hold is the best vaccine for you. So that's the take-home message. Now, if the pandemic is becoming under control, like I think in the UK, where they vaccinated with at least 1 dose people with AstraZeneca or Pfizer vaccine, and they started seeing cases come down. They were worse off than Malaysia at the beginning. And now they've vaccinated at least with 1 dose, a large proportion of the population. Things are looking better. Then you re-examine the risk benefits. And they have said that for younger adults below the age of 30, perhaps, we would not use AstraZeneca. Perhaps they will use the Pfizer or other approved vaccine for them. So, but generally in Malaysia, it's 18 and above is allowed. It is something which you have to have a conversation with your doctor if you're not sure. But when the country situation is very bad, I think the best vaccine you can have is the one which is available to you earliest, because that's the only thing which is going to get us out of this pandemic. Otherwise, we'll be forever in lockdown, in MCO 3, 4, and 5, and the hospitals are in bad situation.
Okay, thank you so much, Alan. Now, for the rest of the audience out there, I want you to respond. Those of you who feel very comforted or relieved by the information given to you, just put a like on Facebook so we know you're all still out there and the message has had some effect on all of you. Very good. Thank you so much, Alan. Now, we'll go to the next speaker down the line. Now, COVID in children, a very controversial issue. Just data that came out for the United States yesterday, 4 million children in the United States has already had COVID, and there have been 300 deaths from COVID-19. A lot of issues arising. And even the Director General of Health has said that the number of young children in Malaysia getting COVID is now on the rise. And so young people in the UK as well. And to share with us his wisdom in this particular area is Ian Ping, who is a renowned pediatrician at the Sunway Hospital. He's going to be sharing with us about this rising incidence of COVID-19 in children and teens. Should we be worried? When should we vaccinate children? What kind of vaccine should we be using? So over to you, Ian.
And thank you, Dr. Peter. My name is Dr. Yen, and I'll be providing some data slides to answer Dr. Peter's inquiries. In the first slide number 1, as you can see, it provides the number of COVID cases in Malaysia since the start of the pandemic to June 2021. As you can see, the total number of COVID since the pandemic is around 580,000, with a total death of 2,867. By now, the numbers will be higher. And in the next slide, please. As you can see, the total case for children are approximately 82,000 with 15 deaths. Children accounts for 14% of all the total case of COVID in Malaysia. And the case fatality rate, which is CFR, is 0.02%, which is much lower in comparison to adult that is calculated around 0.5%. For those who may not know, under our Malaysian Child Act law, the age of a child is defined below 18 years old. And you can see that the incidence rate is highest among the middle-aged group, the young adults. Okay. In the next slide, the next slide, the incidence rate in the children is actually lowest, while the highest is in young adults, and the number of deaths in children is lowest, while the highest age group in the death rate is actually elderly age above 80 years old. And among the 15 deaths in children, the majority of them have comorbids. Most of them reside in Sabah, and some are foreigner. So in the latest news, there are imaging reports in Brazil reporting more than 2,200 deaths below 10 years old. And furthermore, there are reports of further complication in COVID in children. For example, in a study of 518 children in Moscow hospital, there were research showing that there's long COVID symptoms in children that persist in 9 months and above. The symptoms were like fatigue, sleep disturbances, and sensory problems. Also, for now, after a year of pandemic, the doctors, especially in children, has detected multi-system inflammatory complications. For example, like Kawasaki-like illnesses in children. The treatment is similar to Kawasaki, where we give IVIG, immunoglobulin, as well as steroids. In the next slide, 4. Next slide, please. Yes. Okay, I think Dr. Peter has mentioned about the second question of vaccinating children. In the current updates, WHO does not currently recommend children to be vaccinated. WHO advised countries to donate vaccine to low and lower middle income countries where supplies have not been adequate. For our country in Malaysia, MOH Health Ministry has not approved COVID vaccination in children yet. But individually, I think our recommended suggestion would be to vaccinate high-risk children first. The high-risk children would be children with respiratory lung disease, for example, cystic fibrosis or asthma. And I think it's a better choice to use our limited vaccine that is available to be given to the elderly high-risk group in Malaysia before we vaccinate children. We may not see very rare side effects until we see vaccines in larger population in children. However, I think the discussion among the public health doctors as well as KKM, the population of children below 18 years accounts, I think, around 30% of Malaysian, which is around 9.6 million children. As I mentioned before, 14% of COVID cases are children, and it is rising. It will be difficult to achieve herd immunity without the help of children. The newer variant of COVID may be more contagious in children, and some children are unable to wear masks or comply to masking. Because of this, I think there are some countries who are starting to vaccinate children. Countries like Singapore have begun. Next slide, please. In slide number 5, according to Pfizer official data, phase 3 trials include 2,260 children in US, show that it is effective with robust antibody response. The children tolerated the vaccine well with no major adverse problems, and the trial will be monitored for 2 years. However, there are new reports of myocarditis, which actually means heart inflammation in children. And this was reported in Israel and US military patients that after second dose of Pfizer, 7 children have been reported to have myocarditis. And for Sinovac, the press release from their companies show that it is actually safe for children around 3 to 7 years old. But these are based on preliminary data. There is no caveat or published official data yet. For AstraZeneca and other vaccine companies, they are doing trials in children aged 6 to 17, but there are no press release or data still. So for children in the countries that want to vaccine children, they have been using Pfizer as the main vaccine. In the next slide number 6. Okay. I'd like to emphasize that all 3 vaccines in Malaysia are safe for breastfeeding mothers, but only Pfizer is approved for pregnant mothers between 14 to 3 weeks of gestation in pregnancy. Okay, thank you.
Right,
Back to you,
thank
Dr.
you
Peter.
so much. Thank you so much, Dr. Ian. Now, I want to take a poll. Perhaps all of you who are listening through Facebook or YouTube, give us a thumbs up if you think that children should be vaccinated given our current pandemic climate where we're getting 5,000-6,000 a day. I know WHO hasn't agreed that we should do it, but given our current situation, do you think as a parent, it is prudent for you to vaccinate children? Just send us your the response so that we know where you guys are heading. I hope this has allayed some of your fears. We'll just go on. I think Ian has just mentioned some problem with young children with heart trouble. So that brings me to the next speaker. We're very privileged to have Dato' Yap Lok Bin, who's basically been a long time cardiologist in the IJN, who has then shifted to Subang Jaya Medical Center. I work with him personally. He sees all my heart patients anyway. He's an excellent cardiologist. So I managed to rope him in today to share with us COVID-19. How does it affect the heart? Should we be worried if the government gives us Pfizer vaccine? Over to you, Dato' Yap.
Hey, thank you very much for inviting me to speak. My presentation will be fairly short so that we have some time for questions at the end. Are you helping me to control the slide? Sorry. Can I go to the next slide? Okay. So, in fact, what I will do for my talk is very quickly start with questions that are commonly asked, because over the last year or so, there have been many questions from cardiac patients. So, and increasingly, especially with the introduction of vaccination, with even more, almost every day, me and my cardiology colleagues are getting questions from our patients, leaving messages or through the phone. And the first and most common question is, should patients with heart conditions, so I have a heart condition, should I have vaccination, or am I more likely to have a blood clot or have a heart attack when I have a vaccination? So the simple answer is definitely. Patients with heart conditions, especially patients who have coronary heart disease, previous heart attack, heart failure, hypertension, pretty much across the board, when heart patients get COVID-19, they are outcome is worse. It's been shown to be worse. So if all these patients get their vaccinations, then I think there is an overall likelihood that we probably will be, saving lives through vaccination. Are heart patients more likely to develop problems after the vaccination? The answer is not to our knowledge, no. Currently, no. So it's definitely recommended that patients with heart conditions should have vaccination. Next slide, please. So the other common question that we get regarding medications. So many patients who have heart conditions on blood thinners, for example, aspirin, Plavix, these are the most commonly used blood thinners. And they worry that these blood thinners will thin the blood too much and something bad might happen when they have the vaccination. So the current recommendation is you can actually continue these blood thinners. So not necessary to stop. And these are simple blood thinners, antiplatelet drugs. And then, of course, commonly, patients who are on blood pressure medication, they also ask the same question: should we stop the medication prior to vaccination? And the answer is no, we continue as normal. Now, there is one category of medication, which is the anticoagulant, so the stronger class of blood thinners, such as warfarin. You may or may not have heard of these, but some of the patients might, some of the listeners might be on these drugs. Xarelto, Eliquis, and Pradaxa, these are stronger anticoagulants. I would say I would not give an answer just like that from the top, just as there's no misunderstanding. There are various practices. Currently, one of the common practices is to stop the blood thinners for about a day or two while having the vaccination, and then restart after. The reason for that is because when you're on very, very strong blood thinners, you might get a bit of bleeding or bruising when you're on very strong blood thinners. On the other hand, the needle for the vaccine is actually very, very small. So the likelihood of that is actually very low, and it would even be not a major issue if one were on the strong anticoagulation and had their vaccination. Next slide, please. Okay, the last question that we always get asked, someone says, oh, by the way, I just registered for the AZ vaccine, and because I have a heart condition, should I wait until I get Pfizer, or should I wait until I get Sinovac? This is a question that's been very commonly asked. So, I mean, for us, the simple answer, as we've discussed, is the first vaccine that you can get hold of is probably the one to go for, because you never know when the next infection is going to come, and if you're a heart patient and you get COVID-19, then it's going to be problematic as well. So no current recommendation for one over the other for heart patients. Okay, I might pause there for a second because my next slides will be on myocarditis for Dr. Peter. If you have anything else you want to discuss on the first common question section, otherwise we can actually wait for questions.
Well, I got a question here. I got a question from someone who's sent a question to us here. Let me just check that it's got to do with the heart. Okay, I'm 33 years old. I went for AZ vaccine 2 weeks ago, and now she's having very bad pain in the heart and headache, pricking and stabbing, feeling 3-4 times a day. Is this something to worry about? She says she's got some chest pain 3-4 times a day and headache as well, pricking and stabbing. This is 2 weeks after AZ. Is there anything to worry about?
I think I would recommend that you see a doctor to get some simple things checked out. So we just want to make sure that common parameters like blood pressure, oxygen saturation, there's no fever, and maybe an ECG, just to make sure that there are no signs of, actually what I'm about to come on to some of the newer effects post-vaccination that we're seeing. But in general, we don't know if these symptoms are related to the vaccine because it will be a bit unusual. Commonly, what patients are getting now, people are getting post-vaccination as effects are lethargy, a bit of fever, and then of course there are some atypical, unusual things like some people feel giddy, cannot sleep. But if you have chest pain, then usually that is potentially a bit more serious, and I would recommend you go and see a doctor just to get checked out. And if nothing serious comes up on the check, then probably wait a bit longer and see if the symptoms settle.
Okay, good. Thank you so much. Why don't we carry on with the other part of your presentation?
So the second part is something that I think is a bit more topical. More recently, we have had reports of myocarditis. So I'm going to talk a little bit about myocarditis and the vaccine, particularly the Pfizer vaccine. Next slide, please. So, myocarditis is a form of inflammation, and just to help people understand what inflammation does. Inflammation is something that is, a very common disease process throughout medicine, and usually the signs that we see are heat, feeling hot, redness, swelling, and also pain, significant pain. So what are the examples of some conditions? Next slide, please. So these are conditions that are examples of inflammation. These are what you can see from the outside, things that like joints, for example, inflammation of the joints. In this case, in the top picture is a knee inflammation. Then you got a toe inflammation, so the redness is there and the swelling. You have eye inflammation. And the last picture is not plastic surgery gone wrong. It's not the dermal filler. It's actually inflammation of the lip. So examples of inflammation. So why this is important? Can you go to the next slide? Because COVID, very unusual. This disease we found is particularly unique in its severity, and how it's so severe is unlike many infections of the lung. For example, flu and bacterial infections. I'll show you an example of a CT scan. Yeah? And COVID is very unique in causing very aggressive inflammation of the lung. And this is why a lot of people who get severe COVID develop scarring of the lung. So if you look at the CT scan, this is looking inside the lung on the left side. This is what a relatively healthy lung should look like. In fact, there is some early sign of infection even on this picture. But with COVID, sometimes what we find is that relatively well patients who may have just a bit of fever and sore throat to start with, and we're not talking about all patients, they are just a subset of patients, a few patients might subsequently develop very bad inflammation. And their CT starts to look like the one on the right there. You see a lot of white patches developing. And you can imagine if your lung has so many inflammatory changes, then it will be very, very difficult to breathe, very difficult to absorb oxygen. And these patients may end up on a ventilator, and some of these patients may succumb to COVID-19 just because of this severe inflammatory response, and which is why steroids and anti-inflammatory medications now form a very important part in the treatment of COVID-19. So this is lung inflammation. If you go on to the next slide. So what about heart inflammation? So the name myocarditis refers to inflammation of the heart. Now, in terms of people who have COVID, it is actually very rare. I think it's way less than 1% of COVID cases which have been reported to have myocarditis. And what are the things that come with myocarditis? If you go to the next slide, please. So inflammation of the heart can cause chest pain. Yeah? So that's pretty logical, as well as breathing difficulty and palpitations. So these are all symptoms that are commonly coming with any kind of serious heart problem. These are the common symptoms. But in addition, because it is an inflammatory condition, you can also get fever. So that's why the recommendation is, if you have COVID, or if you have COVID vaccine, we are still talking about the same outcome. You have these symptoms, then you may wish to consider this possibility. Of course, this is very, very rare. Now, the picture on the right, this is one of the ways that myocarditis can be confirmed. There are several ways. We can do blood tests, we can do heart tracing, ECG, echo, which is ultrasound imaging of the heart. But this picture here is an MRI, and you can see on the MRI, the shape of the heart and where all the arrows are pointing are some color changes, particularly in the white. It's because on the MRI, when you actually give a form of dye, they do light up certain areas when the areas of the heart, in particular, these are the muscle walls of the heart, they are inflamed, so they start to turn white looking. And that would confirm a diagnosis of myocarditis. Next slide, please. Okay, so where does this report for myocarditis come from? It's actually recently in the US, the FDA has already reported in the news rare cases. Currently, out of about a total of 150 million doses of vaccination with Pfizer. So in the US, Pfizer and Johnson & Johnson vaccine are the common vaccines used. So that's why a lot of these reports for the Pfizer vaccine comes from the US. So they found that a subgroup, is very unusual, because in the AZ group, as Dr. Allen had mentioned earlier on, particularly young women, females, they are getting blood clots. And this one is very unique to males. So young males between the age of 16 to 30 are predominantly the ones getting these cases of myocarditis. And so about a few days to a week, and especially after the second dose vaccine, they are showing some signs of fever and breathlessness or chest pain. And subsequently, many of them went to hospital to have the tests and checked, found that they have had confirmed myocarditis. Now, many of these patients turn out to be okay, but there have been a few cases that require more serious treatment in ICU, and they were hospitalized. So currently, it's still very rare, because we are talking about 200 cases out of about 150 million Pfizer vaccines in the US. So it's still relatively a very, very low rate of myocarditis. Can I have the next slide, please? So in summary, so the first message is that all cardiac patients should have vaccination, and even more so than non-cardiac patients. So please do get the appointments and get vaccinated. And the second point is just regarding this very rare side effect, which is myocarditis. I think the message is, if there is chest pain, shortness of breath, fever after vaccination, to consider having a check. However, just a reminder is that this side effect reaction is extremely rare, and only currently reported for the Pfizer vaccine. Thank you.
Thank you, Dr. Yap. It would seem as if there is basically the risk is with mRNA vaccines, isn't it?
Yeah, I'm not sure, because I looked this up, and currently the pathophysiology, the reason, is really not understood. It's not understood why it happens, and it really is not understood yet. It's too early to say why myocarditis is happening in this particular subgroup also. All we know is that it is confirmed, it is true, but really not very well understood at the moment. And I think that doctors, especially in the US, they're doing as much research as they can to find out why.
Okay, thank you so much for that very clear explanation. So I want time for you all to respond again. If you guys reassured by what Dr. Yap has said, and he said that it's perfectly safe to take even the mRNA vaccines because of the pandemic situations. Can you just put a like on the Facebook so we know you're all responding? Okay, so we'll just take a break to look at the wonderful Alpha program our church presents in case you're interested to join us before we have the last speaker, Dr. Tan Swee Ping.
Life moves fast, doesn't it? Every day there's so much to fit in. But do you ever stop and think, what's the point of it all? Do you ever ask yourself, is there more to life, doesn't it? Every day there's so much to fit in. But do you ever stop and think, Alpha is a series of points exploring life, faith, and do you ever ask yourself, is there more to life, doesn't it? Say what you think and hear about other people's points of view. Alpha is a series of sessions exploring life, faith, first this video is a space where you can ask all the big questions, say what you think, and hear about other people's points of view. Each video explores a different aspect of the Christian faith, and then in a small group you get to say first this video and then discussion. The aim of each video explores a different aspect of each week unpacking, and then in a small group you get to say exactly what you think. The aim of each video is an opportunity for you to hear from others each week unpacking perspective in an honest, open, and friendly environment. So why not try it out? It's an opportunity for you to hear from others and contribute your own perspective in an honest, open, and friendly environment. So why not try it out?
My friend introduced me to Alpha.
I learned about Alpha from my wife, a restaurant owner, which my parents and I have a dinner there. And she's actually kind enough to share the details of the Alpha with us. I learned about Alpha from my wife, a restaurant owner, which my parents and I have a dinner there. And she's actually kind enough to share the details of the Alpha with us.
When you have question, you can go to Alpha because there a lot of people will come. When you put forth your question, they will clarify your answer. See the same thing, you can go different manner, and because different perspective, lot of people will
I
come.
benefited from
When
the
you
Alpha
put
course
forth your question,
through
they will
growing
clarify your
spiritually
answer.
and sharing
See
my
the same
ideas
thing
with other
in
people
different manner
and
and
basically
different
meeting so
perspective
many
you can
other
see.
people. I benefited
I'm able
from
to
the
stand
Alpha
up
course
from floor falling to
through
depression.
growing spiritually
As I've
and
lost my
sharing
son
my
not too long
ideas
ago.
with other people.
What I
and
learned
basically
when I joined
meeting so
Alpha
many
is to
other
ask
people.
questions,
I'm able to
which
stand
can
up
be difficult
from floor
even
falling
for
to
people
depression.
like me who's grown up in church.
As I've
But in
lost
a
my
safe
son not too
environment where
long
you can
ago.
discuss what I learned that you're not sure when I joined Alpha is to ask questions, which can be difficult even for people like me who's grown up in church. But in a safe environment where you can discuss things that you're not sure about or work through your doubts.
Nice game, nice people, so I had a lot of fun also.
Right. We're back here today with us. We are very privileged to have a very prominent
Life moves
physician
fast,
from
doesn't it?
Klang, Dr.
Every day
Tan
there's
Swee
so
Ping,
much to-
who's been with our church for many, many years. And he's going to take up the challenge of these various allergic reactions to vaccinations. What are the risks? And also there's this thing that's coming out, long COVID, that seems to affect so many people. Is it something to be worried about? What is long COVID and how can we treat it or prevent it? Over to you, Dr. Tan.
Yeah, thank you, Peter. Right, welcome back, everyone. Well, one of the most commonest questions that people ask is about allergy. Like, I'm allergic to this, I'm allergic to that, I have skin allergy, right? Can I go for vaccination? Okay, we try to clear this up today to allay your fear. Okay, to start off with, right, let's get the terminology right. Okay, what is allergy? Allergy is a non-life-threatening a non-life-threatening reaction to a foreign substance like an allergen, which could be a seafood, could be your lobsters, peanuts, strawberry, and also it could be due to drugs, common drugs like painkiller, Onstan, mefenamic acid, and agoxia, Brufen, or Voltaren, which is a very commonly available medicine, painkiller, paracetamol as well. And some of the antibiotics like penicillin-based, these antibiotics, for example, amoxicillin, or even the sulfur-containing antibiotic, which is now not so free available. I think it's not very popular now. It's known as Bactrim or Septrim, right? So this has got a sulfur, and many people can have allergy to that. And also some insect bites. So this is allergy, right? Okay, where else? Anaphylaxis. Anaphylaxis is a life-threatening reaction. It is a very severe form of allergy, resulting in swelling of your trachea, swelling of your airways, bronchospasm, and not able to breathe. And blood pressure can drop very fast. So within minutes, you can collapse. So without immediate treatment, one can die within 15 to 20 minutes. So there's a difference between allergy and anaphylaxis. One is non-life-threatening, one is life-threatening. Okay, symptoms of allergy is very simple, very mild, like rashes or hives, urticaria. You have patches, broad patches of itchy redness on your skin that we call urticaria. Okay, you must probably will have facial swelling, eyes swollen, and then the itchy eyes, sneezing, and then swelling of your lips. So this is a common allergy, which is different from anaphylaxis. Okay, if you had history of anaphylaxis to drugs or bee sting, well, it does not mean that you will have anaphylaxis to COVID vaccines too, unless the drugs that you had allergic to, right, contain some of the chemicals that are present, that are contained in the COVID vaccines, like PEG, right, which is polyethylene glycol, PEG, or polysorbate. These two chemicals are present in Pfizer vaccines and the AZ vaccines, but it's not in the Sinovac. Okay, so in fact, these two chemicals are quite commonly found in a lot of the chemo drugs, actually, PEG and the polysorbate. So if you are allergic or have allergy or anaphylaxis to any of the chemo drugs, right, you have to let the vaccination center know and let your doctor knows about this, because there is this chemical is present in the vaccine. So, but you have allergic, this anaphylaxis to drugs that don't contain PEG or polysorbate, you are safe to proceed to for vaccination. But then again, right, whether it's allergy or anaphylaxis, right, I think best is you let the doctors at the center know about it, and you stay there for at least half an hour for observation. Okay, so you had history of anaphylaxis to a polysorbate, probably you may be given the different vaccines like Sinovac actually, because it doesn't contain this. Okay, so we send our children and the babies for multiple vaccination for the first 2 years of their lives actually. So, but there's no hesitancy among the parents, the people don't ask questions, should my children go for vaccination or not? To get a measles vaccination, just in case of allergy. But because the rate is so low that we don't have a question about it. So is there any documented anaphylactic reaction in children's vaccination, immunization? Yeah, there is. Actually, it's very low, only about 4 to 5 per million per million of measles vaccination. Like chickenpox, maybe 1.2, 1.3 only. What about flu vaccine? Now we jab year in, year out, only about 1.5, 1.8 per million. So benefits definitely outweighs this risk of infections. So the bottom line is whether you have allergy, whether you have anaphylaxis, right, the best is you let the doctors at the vaccination center know, and assessment will be done, and you should be observed for at least half an hour to an hour at the vaccination. Okay. Thank you. Right, Peter, should I proceed?
Okay, so let's talk about long COVID, and then we'll have some questions after that.
Okay. Right, long COVID, right? Okay, let's start with flu. Actually, flu is a virus. COVID also is a virus. After a bout of flu, some can continue to experience symptoms like fatigue, lack of appetite, some body aches for some time. This is what we are known as the post-viral fatigue syndrome. Okay, some years ago, if you can remember, right, during SARS epidemic, many developed chronic fatigue symptoms like feeling tired and weak, and for weeks and months. So that was known as chronic fatigue syndrome then. So similar pattern, right, is seen in COVID infection, and many continue to experience symptoms for weeks or so. So the symptoms that are documented are same, tired, fatigue, not able to focus. So they have difficulty in the focusing. Some even have a bit of memory impairment, loss of taste, loss of smell, a bit breathless, headache, joint pain. Actually, a study done in the UCL shows there, right, that there are 208 symptoms. Even after 3 months, 208 symptoms were documented. So it's a whole long list of symptoms after COVID, right? So this is known as post-COVID syndrome. In short, it's known as long COVID. Okay. What about the statistics? In the UK, the national statistic in UK, right, follow up 20,000 patients, 20,000 test positive patients in UK. 3 months later, right, 13% still reported symptoms. And majority of these patients who reported symptoms are in their 30s or 50s. So they're quite young, actually, 30 to 50. So this a big group of COVID patients who are lumped together, right, 20,000 of them. So what about those who are hospitalized? So study is done in the Leicester University, and Leicester University done the post-hospitalization COVID study. They look at 1,000 hospitalized patients, meaning that these patients are in their category 4 or category 5. And 70% had not fully recovered from symptoms after 5 months. A majority of them are females, and the majority of the elderly, especially those with comorbidities like they were probably hypertensive, diabetes, heart disease, So these are the people who are more likely after hospitalization to get long COVID. Okay, over here in Malaysia, well, we have a similar set of results actually. It's just reported about 2-3 days ago by Tan Sri Noor Hisham. So we have 1,004 patients, so 1,004 category 4 and 5 hospitalized patients. And this is Malaysia, okay? 66% found to have long COVID after 12 weeks. So we have a similar result here and what we got in the UK. Okay, what's the mechanism? What's the problem behind this long COVID? What causes long COVID, right? Actually, we still don't know. I mean, not much is known yet, but some theories, right? Okay, it's possible that some fragments of the virus, some protein molecules are still in our body, and these protein molecules causes havoc in our body, disrupt our body functions and causes symptoms. Right, this is one theory. And the second theory, right, is about autoimmune. And I believe that you guys hear a lot about this word autoimmune since the pandemic, right? So because autoimmune means that our body's the immune system go haywire. Our body's antibodies, right, it's attacking our own body tissues and resulting in all these symptoms. So autoimmune is one of the reasons why we have long COVID. So what's the treatment? Well, currently, right, the treatment is supportive. So if you have pain, take some painkiller. So get some MCs, you have good rest, good diet, some simple exercise. So is there any good news or not? Well, there is. There's some good news, right? But this is anecdotal, okay? There's anecdotal evidence that vaccination may reduce long COVID symptoms. So the study was done in 66 hospitalized patients. That's a very small study, right? 66 only. 44 were vaccinated. 44 of these hospitalized patients, right, were vaccinated subsequently, right? And then 22 were not vaccinated. Out of 44 patients that were vaccinated, 23% improved. So in medicine, right, 23% is significant. So 23% of the 44 who got vaccinated improved. And the interesting thing is there's no difference whether it was given Pfizer or given AZ. So both are equally effective. But this study is not been peer reviewed yet, okay? So we hope to see more results coming on in weeks to come. So, but how did this vaccine help? Again, because the theory that I mentioned, so because there's still some viral particles lingering in the bodies, we call it a viral reservoir. And so this strong immune that we get induced by the vaccine help to eliminate some of this remaining virus. And also because of the autoimmune problem, right? So this may temporarily give relief to our body system. This is how we get relief from this vaccination. And so there's another good news, right? The study is done in Cambridge University, and the name of the trial is called HEAL COVID, HEAL COVID, COVID, HEAL COVID trial. So in Cambridge University, right, the hospitalized patients upon discharge were given two medicine. Now, very simple, anticoagulant and an anti-inflammatory drugs. So the anticoagulant that was given was episegbent, which is Eliquis. And the second drug, the anti-inflammatory that was given is surprisingly is cholesterol-lowering statin, is atorvastatin. So atorvastatin is a very good anti-inflammatory drugs, which help to stabilize our plaques, if you have a heart disease. So these two simple medicines are given post-discharge. But we haven't got the result yet, right? We are waiting for more results to come in. Okay, any more good news or not? Yes, one more good news to prevent COVID, long COVID, is to get yourself vaccinated. Well, then again, the question could ask, which is the best vaccine? Okay, I think we have addressed the issue, but just let me tell you, right, up to now, right, there's no head-to-head study between Pfizer and AZ or between AZ and the Sinovac. But all these three vaccines are approved by the WHO to be used in Malaysia. So the one they're going to get in front of you when you go to the vaccination center, right, that is the best one for you because it's proven by more than 90% is effective in reducing the severity and complication of COVID infection. And there's more than 90% reduced hospitalization. So you don't have to go to Sungai Buloh, okay? And there is more than 90% reduced mortality, almost 100% the reduction in mortality. And best of all, right, you don't get COVID, long COVID. Okay, all right, thank you.
Thank you, Dr. Tan, for your very clear explanation. So what I'm going to do now is to go into a time of question and answer, and we're going to have all our panelists on board, and I'm going to pass the questions to whichever specialty it is the question has to do with. So I think Swetway has put up some questions. These are all questions from all of you. You send in through Facebook or you send in through YouTube. We will personally answer as many questions as possible for you. So some of the questions have already been answered by our specialists, so we won't be dealing with that. Let's go and look at the first one. If a guy of 25 years has been tested COVID positive, he's fine after 14 days, heard he must be vaccinated within 30 days. Is that true, Dr. Tan?
Okay, after one get COVID, one will have antibodies, neutralizing antibodies. But we don't know how long this neutralizing antibodies have to last. So the best is we get vaccinated. And when to get vaccinated, it's when you're well, when you're out of isolation. Okay, when you're well out of isolation. This for those category 1 and 2. And once you get vaccinated, because vaccination also will prevent you from getting the variant. So because Pfizer and AZ, right, are effective against a variant. But for those who are hospitalized, you might be given convalescent plasma. You might be given the monoclonal antibodies when you were hospitalized. As for patients like this, it's best to wait for at least 2 to 3 months. or you have to speak to the doctor who are taking care of you. Should you given this monoclonal antibodies or convalescent plasma, right? You have to wait for 3 months. If not, you will not going to mount a good response to the vaccine that will be given. All right.
Okay, good. Thank you. I have to make the answers fairly short because there's so many questions coming in. Now I want to put this question to Alan Tay and put a couple of these things together. The first question is, are there any kind of precautions that need to be taken for thalassemia patients with low platelet count when given AZ?
Okay, I think there are two parts here. Thalassemia by itself, there's no contraindication to vaccination. Thalassemia is a red cell disorder, okay? You don't normally see low platelets with thalassemia unless there is some other problem causing low platelets, such as autoimmune thrombocytopenia or ITP. But sometimes patients with very chronic thalassemia, which is transfusion dependent, they develop very big spleen, and sometimes the platelets may be trapped there. But usually those kind of platelet drop is not very severe. Whatever cause of low platelets, generally the guidelines from the Ministry of Health say that if your platelet is more than 50 and stable, there's no problem with vaccination. The main thing about low platelet is bleeding, because it's an intramuscular injection, but the needle is small. So if you press adequately 5-10 minutes after an injection, you shouldn't bleed. Okay. I'll take the next question, which Petechiae is actually bleeding the skin in any condition such as TTS or any other cause of low platelet. Usually will be where it's gravity dependent, so it's the lower part of your body. You usually start off in the legs. Okay, so that's where the pressure is highest.
Yeah, one more question, Alan, which is not on the Slido here. It's just I got it from an SMS. A 68-year-old had a brain seizure and mild stroke. Her doctor advised her not to take AZ, but she's got difficulty with other appointments. If you refuse AZ, which she's already got, can you comment? Should she go for it?
So I presume the stroke is an ischemic stroke, so it's due to blood clot.
Yeah.
Okay. So the mechanism for blood clot in that is very different. As I mentioned in the talk, it is not the same mechanism for AstraZeneca induce TTS or thrombosis, so it doesn't increase the risk. So by itself, it is not a contraindication to AstraZeneca vaccination. So now there's a very rare situation where some people have developed cortical vein thrombosis or thrombosis in the brain, in the veins. Okay, that's a different situation. And some people, that kind of thrombosis, some authorities would not like to give AstraZeneca vaccine. They may advise another vaccine. But the normal kind of stroke which patients undergo does not increase the risk of the AstraZeneca TTS. Okay.
Okay, one of the very quick questions, because I got it asked so many times, even though it's not on the Slido here, is that I've got my menses. Can I go for AZ?
Any kind
Not
here?
me, got menses. So Alan?
Yeah, no, that's not an issue. Okay.
No issue at all. Okay, so you got menses, go for it, no issue. Let's go to Dr. Tan. How soon after COVID can a recovered patient go for vaccination? I think you covered a bit of that, but how soon can they go?
Well, as long as they want out of the isolation for those this category 1 and 2, and anytime, as long as you're safe to go out.
Okay.
Yeah.
Okay, so my child, Dr. Yap, has mitral valve prolapse, heart condition. Is it safe to be vaccinated? And perhaps what kind of vaccine?
Yeah, it's not a contraindication. It's safe to vaccinate. I don't think it matters which type.
Okay, good. Pregnancy. Better ask Dr. Ian this one, since children come out pregnant women. I am 14 weeks pregnant. I've been diagnosed with protein S deficiency. I don't even know what that is, and have been prescribed Clots. Is it safe to take Pfizer or maybe Alan?
I think it's a thrombosis. Yeah, protein S deficiency is a thrombosis issue.
So if
Thrombosis issue.
I
Okay.
think from the earlier talk, the approved vaccine for pregnancy is the Pfizer vaccine. Is that right? Okay. So as far as pregnancy is concerned, it is not a problem with the Pfizer vaccine. Now, protein S deficiency is an inherited condition where the protein S, which is a natural anti-clotting protein, is low. So such patients are prone to blood clots. So pregnancy by itself, as I mentioned, is a higher risk of blood clots. And if you have protein S deficiency, it's so high that doctors would like to prescribe you with a blood thinner to prevent blood clots during pregnancy. Like I mentioned in my talk, also blood thinners by themselves are not a contraindication. Inherited conditions which promote blood clots are not a contraindication for the AstraZeneca vaccine as far as increasing the risk of TTS. But that is not been recognized, not seen in the Pfizer mRNA vaccine. So I don't think there's any issue here. Except that because you're on vaccine, when you jab, please press 5-10 minutes long enough so that there isn't any bleeding or bruising in the muscle. There's no need to stop the anticoagulation. Yeah.
All right. So, Dr. Tan, someone with eczema, is there a need to refrain from taking prednisolone BA4 after vaccination?
Okay, we need to know the dosage of prednisolone, right? If you've been taking like more than 20 milligrams for a long time, so the response that you mount against the vaccine, right, may be blunted. So it's best, right, if you are on the lower dose of prednisolone. But if it's short term, it's okay. The other way to go about it is you can switch to a topical steroid. So meanwhile, if you're on high dose of steroid, more than 20 milligrams, and then after 14 days, right, I don't think there's any problem. Okay.
Good. Okay, another question. With more, Dr. Ian, you need to take this. Will more adults vaccinated, will the virus mutate and target children as the next host? If there is such a potential, what can be done to protect the children?
I think the virus itself doesn't target only children, they target anyone. And I think probably the future will be prevention, which is vaccination and distancing. Yeah. But I'd like to add on with Dr. Tan's definition of immunosuppressed. For children who are taking steroids, we define them as immunosuppressed if it's taking 1 mg per kilo per day for 7 days or lower dose for 14 days. Because some children take steroids.
Okay, good. All right. So there are always questions on ivermectin. We're going to have another COVID-19 survival guide on July the 3rd. We're going to talk about actual treatment of COVID-19 then with ICU Dr. Suresh and also respiratory physician Dr. Chua. So all questions regarding ivermectin we will leave because we're actually going to talk about that particular drug at that time. So if you don't mind, we're not going to answer that for the time being. So is cross-vaccination, different vaccines for the first and second dose available in Malaysia? Is it wise? Does it work? Dr. Tan?
Okay. Well, this issue arises, I think, recently, right, when a lot of people in the EU and Canada, when they were given the first dose of AZ, right, they want to consider getting a Pfizer one for the second dose. So there is a study done in the Oxford University called COMCOV trial. A small study. It shows that, right, the preliminary results show that there are more symptoms after mixing the vaccine. So they get more headache, fever, fatigue, and then they're not sure whether the immunogenicity, whether it's better protected or not. So currently there's no result yet. But this is an interesting issue because if it's possible to mix a vaccine, right, I think the countries who have problems getting vaccine supply, they probably can mix, get the second vaccine as available. The first one they run out, and but up to now there isn't any study that conclusively proven that, right, it's better or getting a broader immunogenicity towards the vaccine. So I think in Malaysia, right, we just go for the same one.
Yeah, you might as well take the next question. I have severe reaction of penicillin, throwing up, tightening throat. Can I be vaccinated? Is there any brand of vaccine I should avoid?
Okay, so allergic reaction or anaphylactic reaction, right, to drugs, right, it's not contraindication, right, because this the content of the vaccine and the content in penicillin are different. So, but one has to be to to make the center, to let the center be aware that you have such problem, and that you get standby there, observe for at least half an hour. There's no issue to proceed for vaccination.
Okay, good. Probably good advice if you have allergic reaction to be vaccinated in a hospital rather than the stadium, because you probably have got better backup there. Right, Alan, given the blood clot risk of AZ, would it still be advisable for those that are higher than normal platelet count to take the AZ vaccine? I actually got a patient of mine last week. Platelet count was 600,000. Do you think they could have AZ?
Okay, first of all, higher than normal platelet doesn't mean higher risk of blood clot. Some of the causes, particularly common one, is iron deficiency causing a reactive increase in platelet is commonly seen. That doesn't have a higher than normal blood clot risk. Some conditions like myeloproliferative neoplasm, essential thrombocytosis, there's a higher than normal blood clot risk with that kind of platelet count. But as I mentioned in my talk, whether you have an inherited blood clot condition, previous blood clot condition, high platelet count, polycythemia, all these do not increase the risk of the AstraZeneca TTS, thrombotic thrombocytopenia syndrome. At least as far as data, there's no evidence that it does increase the risk, okay? So answer is yes, good.
Okay, good.
ITP condition.
So the next one is yours, ITP, yeah.
Yeah. Current guidelines from the Kementerian as well as the Malaysian Society is, yes, you can have, in general, any of the vaccines, but they would like to see your platelet count above 50. Okay, the magic number is 50. I also want to add in, it depends also what sort of treatment you've had for the ITP. If it's very recently being treated, you're on high-dose steroids, or you're on something which affects the immune system, like rituximab, then you may not respond so well to the COVID vaccination. It's something you need to discuss with your treating doctor.
Okay, I want to take a time off to also answer. See, part of the problem in our country, all over the world, is fake news. And the fake news always believes there's a conspiracy. And on the chat room in the YouTube, I've got some comments from people who are thinking that the doctors here are choosing the questions to answer and then ignoring the questions which these people who are anti-vaccine are posing. So therefore, I'm going to handle this straight on, because the church has to stand for the truth. The question is, the government has only given all over the world emergency authorization for vaccines. Does it necessarily mean they're safe because you don't have a regular authorization for vaccines? Are we avoiding the issue? Can anybody address this?
Is Nobody wants to answer?
No,
yeah.
It's a political question.
Yeah, I mean, this is actually, we are living in extraordinary times, isn't it? Where in a global pandemic, we've got a situation where science has been able to come up with a vaccine fast, do clinical trials rigorously quite fast, and show in every site that you follow the science. The evidence base is there. It shows the vaccines are highly effective in preventing severe COVID hospitalization and practically 100% protection against dying from the vaccine. Okay, based on this scientific evidence, they have to authorize it. Okay, and to give very quick authorization is all called emergency use authorization, because this is an emergency. I think as the data continues collecting, like for example, the AZ TTS was not detected in the initial clinical trial because the trials were maybe about 50,000 people enrolled, but you're seeing a rare side effect like per million. Okay, then you may not see this in an initial trial, but this is the sort of thing where everyone is still learning. And, this is beyond emergency use. Eventually, things will be fine-tuned as we learn more about the disease, the vaccination, and the response. But based on the science that the vaccines are highly effective in preventing hospitalization and deaths from COVID, where you're a situation where you're seeing we don't want to become like India, where you run out of resources, no oxygen, people dying in emergency. I heard in some government hospitals, the situation was so bad, they were expanding the ICU to normal wards, and even ventilating patients in the emergency room because there's no beds. Okay, I mean, do you want that situation to worsen and then you get patients dying? I mean, we can't have a case where you want to have herd immunity due to naturally acquired infection. That's crazy, because you're going to have tons of people dying. You're going to have a hospital system which is overwhelmed. You got to have herd immunity by vaccination, because that's the safest route, isn't it?
Okay, just on that track itself, another person has come up before and said there's a conspiracy that the more vaccination you actually employ in a given population, the more variants will come out. So therefore, we are destroying the world. So that's fake. I believe it's fake news. But we need to answer that with science. Does vaccination increase variants?
No. I think it's the other way around. Lack of vaccination, if you look at the countries like Brazil and India, where it's actually allowed the disease to spread like wildfire. And actually that's what drives mutants. And that's what I believe is the other way around. If you can suppress the infection, that will reduce the risk of mutants emerging.
Okay, thank you so much. Another fake news, this has come around as well. It came out yesterday. Can I ask Dr. Tan to answer this? Taking local anesthetics will trigger allergic reaction in people taking COVID-19 vaccine.
No, the answer is no. Okay,
no,
so look, yeah, I've checked with the dentists and the anesthetists. This is a fake news. And in fact, the Dental Association has also issued a statement that this is a fake news. So it's safe to go for your dental treatment after vaccination.
Okay, Dr. Tan, since I've got you there, there's another article coming out. I don't know whether it's true or not, that the Selangor government is issuing everybody with pulse oximeter. Now, how useful is this if I got a pulse oximeter from the government? What should I do with it? How should it help me compared to a guy who doesn't have a pulse oximeter?
Okay, I think the Selangor government is going to dish out lots of these home test kits. I think cost about 1.3 million. So to the residents in Selangor. So one of the kits they are going to give is an oximeter, which looks like this, the size of a matchbox. Okay, so it's very easy. So you just clip it onto one of your fingers like this and leave it there. Say maybe 10 seconds or so, then the reading will come up. Okay, it will tell you what is your oxygen level. And for normal people, right, the oxygen level, right, usually is about 97, 98. Some may get 99%. Okay, like now, now mine is 99. Okay, so before you rush to get this oximeter, right, just let you know that this oximeter is available in the pharmacy. It costs about 100 ringgit. And if you want to get one, you try to get one early, because different brands has got different calibration. So you have to know what's your baseline. For example, if your baseline is 99, your baseline is 97. Okay, just take note on that. And the guideline is if the oxygen level drops less than 3%, by 3%. If your normal is 97, you drop to say 96 or 95, you should be worried. So this oximeter is for those who are on home quarantine, which are category 1 asymptomatic, or category 2 who are symptomatic but without pneumonia. So this is to watch out the danger signs. One of the danger signs is when the oxygen level drops. There are some other danger signs that you have to watch out for when you're on home quarantine, like persistent fever. You can't get out from the bed. You can't walk around. You have chest pain. You cannot breathe. All right, and your appetite is down, and you are very tired and fatigued. So cannot breathe is a very subjective, right? So this oximeter, right, is very handy, right? If you drop less than 95%, that's a guideline. Less than 95%. You have to inform the health officer via the hotline, or call the health center, or call the ambulance. And then you have to be admitted to the hospital, because this is the danger sign. Before anything, things may get worse from there. All right. So this is the oximeter.
Okay. Good. Thank you so much. Just a quick one, Dr. Ian. Is it safe for young people or immunosuppressed to take the vaccine?
I think the definition of immunosuppression individual, it depends on the doctor. Usually, if it's on very high dose steroids or on cyclophosphamide, there's a quite absolute contraindication. They will not give to vaccine. But I think in the long term, when it's safer, when the children are actually on very low dose of immunosuppressant, I think there is a tendency that doctors will one day approve inactivated vaccine for children. But I think for now, many pediatricians are on a cautious side of observing and getting more data before they decide.
Okay,
so now, I don't think they are at the risk of, I don't think the doctors are going to vaccine immunosuppressed children yet.
Okay, next one is I'm taking blood thinning medication to cut down my cholesterol, which is wrong. Do I need to stop taking either of this actually before my vaccine? Like that, Dato Yap handle this. There are not many heart issues coming out, so therefore I have to throw him a question or two.
So I assume that the blood thinning medication is the simple type like aspirin or Plavix. The answer is there's no need to stop taking before the vaccine, and there's also no need to stop taking cholesterol medication also. Yeah.
All right.
If there
so
is,
there's this. Carry on.
Sorry, if there, but because it doesn't say which type of medicine, but if one is on the strong blood thinning medication, as I said before, I think it would be advisable to discuss with them.
Okay, good.
Patient's doctor.
All right. So what about I'm taking Astra vaccine next week. Do I need to take Panadol 6 hours before the vaccine? Very common question, Can Dr. Ian, you answer that?
I think we mentioned last week, the CDC guideline says do not take any painkiller or antipyretic medication before vaccine, but you may do so after that. Yeah,
okay, good. Doctor did brain CT, found no issue, did not check the heart. They said it was a side effect of AZ. Is this worrying pain? I assume this person got chest pain. Dr. Tan, is there anything to worry about? It's a very funny question because we don't know what's happened. He did the brain.
It's too vague. The question is too vague.
It's too vague. Okay, well, let's ignore that one. Okay, let's go to. We've already answered this other one. Let's go down. AZ is safe for all Malaysians. Go down. Okay. I think Dr. Allen has answered this blood clot risk. Okay, are the current generations of vaccines efficacious against variants and new mutants? What did Ian, you try that?
Yeah, I think studies have shown that Pfizer and AZ are quite effective against the new Delta variant as well.
Yes, as the data shows. You see, we've got new flu vaccine every year, and you find that because the genetic variation in flu vaccines of influenza virus is very great, the variation in COVID is not too bad, so it's still effective. Okay. I think we've already answered this other question. Next one, we're banking 100% on EU vaccines as doctors have decided to go on their own way and prescribe. We don't do ivermectin until next one. Okay, this one. Alan, I'm 60 years old, had DVT October after the TKR, was on dabigatran for 3 months, cleared off. Am I all right to have vaccine?
So she's no longer on the blood, no longer on the blood thinner, so there's no issues with bleeding with the intramuscular injection. If you're going for the AZ vaccines, as I said, previous deep vein thrombosis, whatever cause, does not increase the risk of the AZ TTS or thrombotic thrombocytopenic syndrome side effect of AZ. Okay, so perfectly all right.
Okay, good. Young women, menses, we already covered that. Okay, what happens after we take 2 doses? Is there a need for a booster every year, Dr. Tan?
Well, currently, right, there's no recommendation, but we take flu jab every year. So there's a possibility, right? We can't answer this. Let's wait for more results to come up.
Okay, good. All right, next slide, going further down, please. Can we slide the question down? Any other questions? Any medications to stop before taking vaccination? Do you all know of any vaccination medication in your specialty that you have to stop before you take medication before vaccination? Anybody? No? Okay, that's good. All right. Will home quarantine cause more lung damage from COVID because no treatment? When should I call for medical help? What signs to monitor? Very, very practical question. I'm sitting at home. They ask me to stay at home. How do I know when I'm bad enough, Dr. Tan?
Yeah, one thing which I mentioned just now, okay, you have to watch out for some danger sign, okay, because the time to be short. Okay, persistent fever, okay, you have fever, usually fever lasts a day or two, but if you have fever like 3-4 days, you have to watch out, right? And then second thing is chest pain. Third is breathless. You're getting more and more breathless, and the persistent cough, and you are not able to get ambulate, difficulty in getting up from your bed, and you are very, very tired, and not much of appetite. And of course, what you have oximeter, right? Have a look at the oximeter. If you don't have, you probably can check your breathing rate. I think it's a bit difficult. A normal breathing rate is about 15, 16, 17, right? If your respiratory rate, right, is more than 25, that's alarming. Okay, more than 20, right? I think you have to maybe check with your doctors who probably can measure for you, or consult a doctor or GP, right? So with any of these dangerous signs, one has to be admitted. Okay.
Okay, good. All right. Alex Wong asked on YouTube, can I take antibiotics before and after vaccinations, Dr. Tan?
Say again?
Alex Wong asked on YouTube, can I take antibiotics before and after vaccination?
Yeah, can, no problem.
Okay, Florence De Silva asked, can I take steroid asthma medicine before vaccination? Hello, Dr. Tan.
Yeah, depends. I mean, if you are having a bad attack of asthma, I think it's advisable to defer the vaccination, right? Because rule of thumb is if you're having an acute problem, right, I won't advise you to go for vaccination, or any vaccination for that matter. But if the asthma is well controlled or maintenance dose of less than 20 milligrams of prednisolone, right, I think there is no issue. All right.
Okay, very good. Thank you so much. All right, so we are coming to the end of our time. We're almost 3:30 on the dot. So probably going to take if you got any last minute questions, you guys just post it on Facebook. We're going to end after 1 or 2 more questions. Just a comment from Kelly Esther Young. I got my oximeter from Lazada at $22.46 from a Malacca supplier, just to let you all know. I wonder if it works. $22 oximeter. What do you think, Dr. Tan?
Can I just chip in? I've seen some of these very cheap oximeters. They may not be very accurate when the oxygen saturation drops very low. I have this issue. So the different grades, like everything else, what is cheap is seldom good. What is good is seldom cheap. Okay, but I can't say whether yours is bad or not. But maybe compare with better oximeter. But bear in mind, when the oxygen saturation drops, the cheaper ones may not pick it up so well. But there are also different grades, whether they are CE approved, and even a Malaysian MDA approved, medical device authority approved pulse oximeters. So those may be a bit more expensive, and usually around 80, 100 plus. Okay, the cheaper ones you buy online will be maybe $50, $40. Some they work okay, but there's a question of whether or not it would be less sensitive to lower oxygen saturation.
So the latest check at the pharmacy is about 180 ringgit a piece. 180.
What do you think about the oximeter in the iPhone? Does it work? Can we rely on it?
There's no oximeter.
I think it depends on the QC control. It depends on the QC control.
Apple Watch. You mean Apple Watch?
Apple Watch, yeah. So does it work or not, Alan?
Seems to be okay, but I don't know it depends on the contact also. So that seems to, if it's a bit loose, you may not be detected so well. Yeah. Okay,
you guys, so better go to the pharmacy and buy the $180 one. I watch is too expensive. Anyway,
there's a lot of recurring questions on previous blood clots, strokes, cardiovascular disease, and all these do not increase the risk of the AZ TTS. Okay, the AZ TTS is a very specific mechanism, and as far as the current guidelines from authorities show, they do not increase the risk of the AZ side effect. Okay, so it's a recurring question.
Yeah, and then there's one question now here just popped up. I recovered from dengue 2 years ago. Dengue associated low platelet count. Do I avoid vaccines?
Why should you? Why should you avoid vaccine?
Well, because of the platelet issue with AstraZeneca, I suppose they are worried about that. Can people with peripheral vascular disease take AZ?
Why not? Again, the best vaccine is the vaccine which is available to you. If it's going to be AZ is going to protect you. And having peripheral vascular disease does not increase the risk of thrombosis seen due to TTS. It does not increase that risk. Mm-hmm. Okay, on the other hand, if you have comorbidities like heart disease, hypertension, if you get COVID, higher chance of dying. Okay, dying from COVID. Yeah.
Yes, and the risk of COVID is increasing every single day. And even though we're going to lock down, it's going to take a while for us to get better. Well, I think it's about time for us to wrap up today. We had a great session with 4 of our great panelists. We've enjoyed our conversations together. Can I have the slide up, please? So, wait, can I have the slide up, please? Well, we're supposed to have a slide up. So, okay, good. Okay, so next slide, please. Right, just remember all the things that we've said to you. If you've got a specific problem, please ask your own doctor for advice. This is a program just for education. Next slide, please. Right. A special thanks to all our panelists who've been brilliant. We've been with us. They've been very cooperative. They're very transparent, answering all the questions. There's no conspiracy, you see. We're not pushing anything, any agenda. We're here for the truth. Thank you, Alan Tay, Yin Ping, Dato Yap, and Tan Swee Ping. And a big thank you to all the technical team, John Lee, Fred, and all the hidden people behind the First Baptist Church Community Connection. They've been working very hard to put this webinar together. Give them a like button on the Facebook to acknowledge our appreciation. And if you want to follow us for future events, which we'll be having every month, please click a like on the Facebook. It's very important. Otherwise, we will not be able to get to you with future programs, our community, our concerns, our connections. Next slide, please. Okay, remember the next event is then on Zoom. Okay, instead of, it will be on Facebook and YouTube as well, but this one will be on Zoom. We're gonna have Dr. Suresh, ICU doctor, and Dr. Chua, respiratory physician, and myself are gonna be moderating. That's a QR code. Now, for this one, the reason why we want you to register is because you can submit your questions before the seminar starts. Now, all your ivermectin questions, all your monoclonal antibody questions, respiration questions, please put them up and we will answer every single one of them. We're not going to hide it and run away from any question at all. Please join us. But this time, it's not Sunday, yeah? There's the change. It's Saturday. We'll try Saturday. Some people are more free on Saturday, 2 to 4 p.m. Next slide, please. All right. So remember, some of you who might be interested in more of the spiritual matters in life, click on the QR code, and that will take you to Alpha, which is a great program that we don't just look after physical health, we look after your spiritual health as well. So on behalf of the First Baptist team, thank you very much. I hope you've had an enjoyable and also informative time. God bless you. See you next time. Thank you, everyone. Thank you, guys.
Thank you, Peter. I had to restrain myself from talking about ivermectin, but then I think we'll leave it to your next session.
So would you like to come on board and talk about ivermectin next time?
Better not, I might lose my temper. Always.
Okay, thank you.
Yeah.